Hi, my name is Ty Lockspizer, and I'm the Assistant Dean for Assessment, Evaluation, and Outcomes here at the University of Colorado School of Medicine. My goal in this short video is to walk you through how to complete a brief assessment form in OASIS for one of our students in the track curriculum. The key thing to know about these forms is it's really about the idea of getting little snippets of information multiple times over the course of the year. So they're meant to be brief, they're meant to be quick. So the first thing to know when you get into this evaluation form is that it can be completed or accessed in two different ways. One, you can scan the student's QR code that they have that will take you directly to this form on your phone, or two, the students can send you an email that would then appear in your email. If you scan the QR code, you'll need to know what your CU Anschutz login is to access the form. If they send it to your email, you won't need to do that as there's a link to bypass logging in the email itself. So the first question that you get to is a conflict of interest question. For most people, the answer will be no, but if you have provided healthcare services to a student, then the key thing is to reach out to the LIC director and to talk with the student about creating an agreement. Next, it asks you which clerkship or specialties does this assessment most apply to. For me, I think about this as what type of patient did you see? Was this a pediatrics patient, a pregnant patient? Was this in the OR, etc.? And if you don't know, just click I don't know, or if at all, just click your particular specialty. Ask for what location, just pick which one it was. And then again, how many encounters or observations is this assessment based on? So if it's just about one particular task, then it can be just one, or if it's something that you're commenting on over several interactions with the student, feel free to select that. The next set of questions asks about for you to select up to 1 to 3 tasks to assess the student on. And this is where it can be a very brief assessment. If all we want to assess is, say, history, then what you'll notice is that it only gives you one particular question for history that comes up next, and then some open-ended boxes, and that's it. But if we choose a couple of different ones, management plan, compassion, then we get a couple of different questions that correlate with each of those particular tasks that you selected. Each of the questions that we have is phrased thinking about a student's independence and how much support they need to provide safe and effective patient care. And so again, these phrases are front and center in our assessments because we believe very strongly that what we're doing is creating independent doctors, and that part of that is thinking about what level of supervision do they need. So don't think about billing rules, don't think about the craziness of your clinic, but think really about what is the student able to do on their own? Do you trust them? And trust involves both knowing their both knowledge and skills, as well as knowing their limits, asking for help, and following up on things. So in this example for history, if I say for a patient with a common concern, if I was to supervise the student again as they gather to history, how would I assign the task to the student to ensure safe and effective patient care? Early on in the year, it really might be, you know what, they can't do enough. We're going to do it together. But later on in the year, maybe you get to the point where they can do it on their own and you just need to repeat key findings. What you notice is that when I click that top box of this particular question, it gives me another question to answer, which then asks, how would your rating change if the patient was medically or socially complex or undifferentiated? And this gets at the idea that oftentimes our students are able to do some of these things independently with straightforward patients, but not when the patients are more complex. And so we only ask you about that in the students that are really getting these skills well with straightforward patients. So we see the same sort of question with management plan. And again, this is something that we don't expect our students to be able to do independently at the end of their LIC. So it's totally fine to check one of these two boxes. You really have to think about, what does the patient need? How much support does that student need for this patient to receive safe and effective care? The final set of questions are really yes/no questions. If I click yes, that the student was compassionate, that's it. But if I think not consistently, then I need to describe what it was that I saw that made me feel like they weren't compassionate. And similarly, if I click exemplary, I want to know why. What did the student do that was above and beyond that made you say that they were exemplary? The final piece of this form includes 2 text boxes for comments. And the comments are crucial. We really, really want detail. We want to know what it is that you saw the student doing and how you made your judgment about how independent they are. So we want you to give some medical details here. We want you to give specifics and describe what the student was able to do. Usually I tend to think of about 100 words as your goal, but if you're really only talking about a pelvic exam or one little piece, it might be shorter. The key thing is specificity. The lax box asks about what does the student need to do to move on to the next level. And in that, I think about what would the student do if they were more independent that they aren't doing now? So what is it that they need to do to grow such that you would entrust them or allow them to do more with less supervision? The following questions are just whether or not you have any concerns and also whether or not you discuss this with the student. When you're done, you can go ahead and hit submit, and that's it. If you have any questions, want to review assessments with anyone, always feel free to reach out. Thanks.